Welcome. Today I am going to share with you Progestogens for irregular menstrual cycle, heavy bleeding, puberty menorrhagia. Progesterone is a natural hormone produced by the ovaries, while progestogens are synthetic hormone drugs that mimic progesterone. Importance of progestogens in women health. Progestogens have a key role in the menstrual cycle, pregnancy, its support for fertility treatments, and reduction of menopausal symptoms. Progestogens are commonly prescribed to manage menstrual irregularities, reduce heavy bleeding, and alleviate symptoms of premenstrual syndromes. It also supports for implantation and early pregnancy. These hormones help to prepare the uterus for fertilized egg and maintain the pregnancy. Women experiencing hormonal imbalances can benefit greatly from progestogens. Many women report enhanced mood stability and relief from anxiety linked to hormonal fluctuations when using progestogens. It plays a protective role against endometrial hyperplasia. It is a condition that can lead to more serious health issues. Understanding the role of progestogen is crucial for anyone interested in reproductive health and hormonal therapies. Progestogens come in various forms, including natural and synthetic types. Natural progestogens include progesterone, while synthetic variation include medroxyprogesterone acetate. Each type has unique characteristics and applications, making it essential to select a right one based on individual needs. Progestogen for puberty menorrhagia. There are two choices mainly, medroxyprogesterone and NorEone. First one, medroxyprogesterone 10 mg. Medroxyprogesterone is a synthetic form of hormone progesterone. It is used in various medical treatments including hormone replacement therapy and contraception. Mechanism of action. Medroxyprogesterone works by mimicking the effect of natural progesterone in the body. It regulates the menstrual cycle, helps to maintain pregnancy, and inhibit ovulation. Uses of medroxyprogesterone: hormonal replacement therapy, contraceptive injection, treatment for abnormal uterine bleeding, management of endometriosis. Next one, how to use medroxyprogesterone. Medroxyprogesterone is the first choice and it is more effective. Use one tablet per day. There are three methods or duration of treatments with medroxyprogesterone. First case is short cycle or heavy bleeding. Meprate or Provera 10 mg. It's contain medroxyprogesterone, one tab daily at bedtime for 20 days, from 3rd to 22th days of cycle for 4 to 6 cycle. Better to start 3rd day instead of 5th day so that the duration of bleeding is shortened in case of heavy bleeding. Full 20 days course is indicated for girls with short cycle. Short cycle means less than 20 days of cycle. In normal case, one tablet daily at bedtime for 20 days from 5th to 24th day of cycle for 3 to 6 cycle. Second case is normal or long cycles. Meprate 10 mg 1 tab daily at bedtime for 10 days from 15th to 25th days of cycle for 4 to 6 cycle. Third one is easy method for normal and long cycles. 1 or twice daily for 5 days from 21st to 25th days of cycle for 4 to 6 cycles. Next one is side effects: weight gain, headaches, mood changes, irregular bleeding, nausea. Next one, NorEone 5 mg. It's available in Primaluten and other brands. Introduction: NorEone is a synthetic progestogen similar to the hormone progesterone. It is used in various hormonal therapies and contraceptive methods. Uses of NorEone: treatments of irregular menstrual periods, management of endometriosis symptoms, contraceptive use in various formulations, hormonal replacement therapy. Next one, treatments of irregular menstrual periods. Primaluten 1 tablet of 5 mg 2 or 3 times per day. Now it's available in 10 mg or 15 mg slow release tablet. Once per day is sufficient. Dosage is almost similar to medroxyprogesterone. First case is short cycle or heavy bleeding. Primaluten or progesterone. It's contain NorEone. 1 tablet of 5 mg 2 or 3 times per day. If it is 10 mg, 1 time is enough. For 20 days from 3rd to 22 days of cycle for 4 to 6 cycles. Second case is regular cycle or long cycle. Primaluten or progesterone 1 tablet of 5 mg 2 or 3 times per day for 10 days from 5th to 25th days of cycle for 4 to 6 cycles. If NorEone 10 mg or 15 mg slow release tablet once daily is sufficient. Side effects: common side effect of NorEone may include nausea and vomiting, headaches, mood swings, weight changes. Next one, combination of oral contraceptive pills. NorEone, Femilon, Duloton, Minisec. It is also explained in the previous video. Next one, Progesterone, Duone. Introduction: Duone is a synthetic hormone that mimics the effect of progesterone. It is commonly used in hormone replacement therapy and to treat various gynecological conditions. Duone is the only one progesterone which does not inhibit ovulation. It is suitable in case of women planning to be pregnant. Higher dosage is required to control bleeding depend upon medroxyprogesterone. Dosage of Progesterone: Duone 10 mg 2 times for longer periods from 11th day to 25th day of cycle to treat irregular periods. Sometimes combination of Duone 10 mg and estrogen used. Uses of Duone: treatments of menstrual disorder, managements of endometriosis, hormone replacement therapy, support for early pregnancy in case of progesterone deficiency. Side effects: nausea, headache, dizziness, fatigue, breast tenderness, mood swings. Next one, levonorgestrel. It's contained in I pill, unwanted 72, overall L. Levonorgestrel is a synthetic progestogen similar to the progesterone. It is available in various forms including oral tablets and intrauterine devices. Mechanism of action of levonorgestrel: prevents ovulation, thickens cervical mucus, alters uterine lining. Primary uses of levonorgestrel: emergency contraception, often used in morning after pills to prevent pregnancy after unprotected sex. Second one, long-term contraception, parts of hormonal intrauterine devices for ongoing birth control. Third one is menstrual disorders, helps to manage heavy menstrual bleeding and other menstrual related issues. Emergency contraceptive pills, typically taken as a single dose or two doses within 72 to 120 hours after intercourse. IUDs, effective for 3 to 7 years depending upon the brand and type. Next one, some examples of intrauterine devices. Jadis, it's up to 3 years. Kylina, up to 5 years. Mirena, up to 7 years. IUCD, loaded with levonorgestrel hormone. It is a T-shaped device. It lasts for 5 or 7 years depend upon device. Side effects: common nausea, headache, fatigue, changes in menstrual bleeding. Serious, rare, but can include severe abdominal pain, sign of allergic reactions. Next one, important points. Progestogen should not be given for long time because it adversely affects the cholesterol balance. It increases LDL cholesterol and lower protective HDL cholesterol. It leads to cardiovascular diseases. Progestogens and menopause. During menopause, progestogens can alleviate symptoms such as hot flushes, night sweats, and mood changes, enhancing the quality of life. Proper management of menopausal symptoms can lead to more positive and fulfilling life post-menopause. Understanding the role of progestogen enables women to explore effective menopause management strategies. Risks and side effects. While progestogens offer substantial benefits, they can also present risks and side effects, including weight gain, mood swing, and breast tenderness. Not every woman will experience side effect, but it is essential to discuss any concern with healthcare providers thoroughly. Thank you for watching.